Hello and welcome. Today we're diving into a urological condition called bladder neck contracture, or BNC. We'll explore what it is, what causes it, how it's diagnosed, and what treatment options are available. Understanding BNC is crucial for both patients and medical professionals. So let's get started. So, what exactly causes bladder neck contracture? The primary culprit is often previous surgical interventions. Transurethral resection of the prostate, or TURP, is a common procedure that, in some instances, can lead to scar tissue formation at the bladder neck. Other surgical procedures, such as radical prostatectomy for prostate cancer, or even some procedures to correct stress urinary incontinence, can also contribute. While surgery is the most frequent cause, radiation therapy for prostate cancer and, rarely, chronic inflammation or infection in the area can also lead to the development of this condition. Now let's talk about what's happening inside the body when BNC occurs. Essentially, scar tissue forms at the point where the bladder connects to the urethra, that's the bladder neck. This scar tissue narrows the opening, making it difficult for urine to flow freely out of the bladder. This obstruction leads to increased pressure within the bladder as it struggles to empty, potentially causing a range of complications, including urinary retention, bladder dysfunction, and even kidney damage if left untreated. The bladder muscle may thicken and become less effective at contracting, further compounding the issue. While precise figures are difficult to obtain, bladder neck contracture is estimated to occur in a small percentage of patients following prostate surgery, particularly after TURP. Studies suggest that anywhere from 0.5% of men who undergo TURP may develop BNC. The incidence can vary depending on the surgical technique, the individual patient's healing response, and other factors. It's important to remember that while not extremely common, BNC is a recognized complication of these procedures. The symptoms of bladder neck contracture can significantly impact a person's quality of life. The most common symptom is a weak urinary stream, as the narrowed bladder neck restricts urine flow. Patients often experience urinary hesitancy, meaning they have difficulty starting the urine stream. They may also feel a sense of incomplete bladder emptying, even after urinating. Frequent urination, especially at night nocturia, and the urge to urinate urgently are also common. In severe cases, complete urinary retention can occur, requiring immediate medical intervention. Diagnosing bladder neck contracture typically involves a thorough medical history and physical examination. The doctor will likely ask about previous surgeries or radiation treatments. A urine test can help rule out infection. Uroflowmetry, which measures the rate and volume of urine flow, is a key diagnostic tool. Cystoscopy, a procedure where a small camera is inserted into the urethra to visualize the bladder neck, is often performed to directly assess the degree of narrowing and confirm the diagnosis. Urodynamic studies may also be used to evaluate bladder function. Bladder neck contractures don't generally have distinct classifications or types beyond describing their severity: a mild, moderate, severe based on the degree of obstruction. The underlying cause, such as post-TRP or post-radiation, is usually noted. The location and length of the contracture can also be factors in determining the best course of treatment. Treatment for bladder neck contracture aims to relieve the obstruction and restore normal urinary flow. Initial management may involve alpha blockers, medications that help relax the muscles around the bladder neck and prostate. However, these are often ineffective for significant contractures. The most common surgical treatment is incision or resection of the scar tissue through the urethra. This can be done with a knife, laser, or electrocautery. In some cases, more extensive reconstruction of the bladder neck may be necessary. Post-operative care often includes catheterization for a period to allow healing and prevent re-narrowing. Recurrence is possible, and repeat procedures may be required. Unfortunately, there's no foolproof way to completely prevent bladder neck contracture, especially after necessary surgical procedures. However, meticulous surgical technique during prostate surgery can help minimize the risk. Some surgeons advocate for the use of certain medications post-operatively to reduce scar tissue formation, but more research is needed in this area. Open communication with your surgeon about the potential risks and benefits of any procedure is essential. The prognosis for bladder neck contracture is generally good with appropriate treatment. Many patients experience significant improvement in their urinary symptoms after surgery. However, recurrence is a possibility, requiring ongoing monitoring and potential repeat interventions. Newer surgical techniques and technologies are constantly being developed to improve outcomes and reduce recurrence rates. Research is focusing on ways to minimize scar tissue formation and promote healing after surgery. Ongoing studies are evaluating the effectiveness of different medications and surgical approaches for managing this condition. Always discuss your individual case and treatment options with your urologist.